This question appeared in NEET PG 2023. A patient presented with painless genital ulcer, and along with the painless genital ulcer there was non-tender inguinal lymphadenopathy, and you were asked for a differential or a diagnosis. Now you will be surprised that this is such a simple question, but still the amount of times this question has appeared in various PG entrance examination. So let's quickly learn about various different types of genital ulcer which are frequently asked. So the first ulcer is of syphilis, and you can see it's a well defined ulcer. We all know that syphilis is caused by a spirochete, Treponema pallidum, and in that what happens, the patient initially presents with a single painless ulcer, and also there can be lymphadenopathy, which is like non-tender rubbery lymphadenopathy. So when I'm talking about syphilis, the causative agent is Treponema pallidum, which is a spirochete, very important to know, and the primary chancre or the primary ulcer may be a non-tender, well defined ulcer, and you can have a non-tender rubbery lymphadenopathy. So this is syphilis. The second image I can which is shown in this exam in this A, this is a chancroid. Now we know chancroid is caused by Haemophilus ursi. Okay. Now this is a very painful genital ulcer, very difficult to measure. And the second very important thing, so you can see the inguinal lymphadenopathy, lymph nodes as well as the ulcers, they are suppurative in nature. Okay, so both of them, they are suppurative in nature. So they are painful. There is lymphadenopathy, but these ulcers or the lymphadenopathy are suppurative in nature. So again, very easy to learn and understand and clinically make out. The third ulcer which I am going to show you is Granuloma inguinale. Okay, now this, if you can see, this is caused by, can you name the organism? It is caused by Klebsiella granulomatous. Okay, and it is basically called as, textbook description is beefy red granulomatous ulcer. Okay, a very characteristic point about this particular ulcer is that if you touch it, they are very frail. They are not painful, but they will bleed very easily. They will bleed very easily. So these are called as beefy red ulcers. They are non-painful, but they bleed very easily. So this is how you will hear. There is generally lymphadenopathy is not seen in these cases in Granuloma inguinale. And so these are the very important ulcers, their description, and how you can clinically understand them. So let's look at the question now. So we saw that there was a painless genital ulcer, non-tender inguinal lymphadenopathy. So we know this can be easily ruled out. So again, this can be ruled out. Let's talk about genital TB. Now we know that genital tuberculosis generally involved internal organs. Okay, and manifesting as external ulcer is very rare in genital TB. Okay, it will lead to chronic pain, menstrual difficulties, or infertility in women. But in general, genital TB presenting as as a genital ulcer is very rare. So the correct answer in this case will be syphilis.